How do we respond? It's extremely difficult to tackle in a uniform manner. You can't pass one law that's going to capture this problem. So I think the first thing you got to do is establish norms. And the ISSCR has taken a leadership role in this, and they are doing that. And the other thing you can do is have professional organizations respond. So you're starting to see this. The ISSCR has passed some great guidelines, which I'll touch on in a moment. Irv Weissman from Stanford has talked about creating a website where there's actually a clinical evaluation of all available stem cell therapies, so patients can go and look and see what the scientific literature says about what these clinics are offering. And there have been professional communities around the world that are sort of speaking out, and I think we need to see more of this. You can also pass regulations, laws, and policies. These have to be done on a regional basis. As I said, it's an international phenomenon. But even in China, where a few of these clinics, I should have to be careful not to pick on one jurisdiction, but a few of these clinics are located, they are trying to regulate what's going on. Now, how these regulations are going to be implemented is still unclear, but you are seeing this movement. It'll be interesting to see how it plays out. I do think we need to educate healthcare providers. My wife is a family physician, and she's had a couple of her patients ask questions about this, and she didn't know what to say. So I think educating primary care physicians, do you have those in the United States? No, I'm just kidding. Educating them to be able to respond to patient questions, I think, is very important. The other thing is engage the media. As I said, very interesting how the media has been relatively, they haven't been very critical. They don't have that critical voice in a lot of the stories. In fact, we're studying that right now to get a sense of how the media is responding to this phenomenon. Here is the ISSCR guidelines. I think this is great if you ever have a patient or someone who's curious about what to do about these clinics or patients that have questions. This is a great example. And here's a list of things that people should look for if they are worried about a particular site. For example, that there's no science, that they claim that they can cure anything, and that the costs for the treatment are extremely high. Okay, I have literally no time, so I'm going to whip through this really quickly. And I know stem cell patent sounds boring. It's not. It's a fascinating topic. I'm just going to give you a taste of it so you guys can get a coffee. I think there are few areas in my world, in the world of ethics, law, and society that have created as much controversy as biotech patents or life patents. Michael Crichton wrote about it in his last book, Next. This is really, really controversial stuff. I mean, people are marching in the street in some jurisdictions over this, not in Canada, but I understand in other jurisdictions. Of course, the purpose of patents is to stimulate innovation. That's the goal of it. Despite that, you do see a phenomenal amount of controversy. And I think most of the controversy can be broken down into two categories. You have a moral, intuitive response to this. It's just simply wrong to patent life. You have a yuck factor response. And you have this dignity commodification concern. Now, these sound sort of fuzzy and squishy, but they have had a lot of traction in some jurisdictions. In Canada, that's the loonie, that's our dollar. This whole concern about commodification really was a big part of our stem cell debate and has been a part of the patenting debate. But in the United States, and I think in most jurisdictions, it's been the practical and utilitarian concerns that have had the most policy traction. This is the idea that patents actually hurt research. It's been called the anti-commons or the patent thicket. And if this is in fact true, this is important because that means the patent system isn't working. Remember, patents are supposed to stimulate innovation. So if this is true, then this is an important thing to worry about. Now, people have claimed, and there has been concern that this is in fact happening in the realm of stem cell patents. There's been a lot of literature on this. Given the characteristics of stem cells and their sort of broadly enabling technology, many are worried that a patent thicket is going to emerge in this domain. So let me give you a sense of what's happening around the world. And this, I find this fascinating because unlike, say, gene patents, where there's a relatively uniform response around the world, you can get gene patents. There has been a diversity of responses. In Europe, under the EPO, you in fact cannot patent embryonic stem cell lines. So the Wharf patent has been rejected. They base this on the morality principles. So not a practical concern, but really about moral concerns about the embryo and the commodification of life. In the UK, so you can get a patent on embryonic stem cells. In the United States, of course, you can patent anything under the sun that was made by man. And in Canada, we're always confused. We don't know if we're European or American. We haven't made a decision. It looks like the way it's going to work is that pluripotent you can patent, totipotent you can't. It's sort of an artificial distinction to some degree, but the argument is that if it's a lower life form, it's just a cell line, you can patent it. If it has the potential for higher life, you can't. So I'm going to zip through this. Basically, there's lots of patents all over the world held by diverse owners, both public and private, oops, I did something bad there. Can you get me up? You know what? I'll just keep talking. So the most famous of the patents, thank you. I'm just going to go back. The most famous of the patents and the most controversial were undoubtedly the Wharf Patents. They've caused a lot of discussion. I'm sure there's people in this room that are familiar with them. Many have argued that the Wharf Patents have hurt research in the U.S. I think the literature on that is unclear. It's mostly assertion and anecdote. The data is not clear. A re-examination of these patents was triggered in 2006 by public organizations concerned about the impact. And the patents were recently upheld. Now, there's an irony here because they were upheld, they're probably stronger and clearer than they were before they were examined. I'm looking at Jonathan to see if he agrees with me on that. And despite this discussion, it is an interesting story because you saw a progressive liberalization of licensing practices around this. And a great article that's not out yet by John Golden, I think it's one of the best articles on this point. It's coming out in the Journal of Law, Medicine, and Ethics in relatively near future. He believes that, yes, it wasn't ideal, but it's hard to argue that in the United States, the patent system did not sort of help get the ball rolling in this context. Okay, so looking ahead, patent issues, I wish I had more time to talk about this stuff. Is there actual evidence of harm? I think it's important to get some actual empirical evidence. I don't think patents are good or bad. It's a very complex story about interplay between public and private financing of research. We did a big study in Canada. We went in thinking that we'd find problems. We didn't. We found researchers who were worried about patents, but we didn't find any evidence of actual problems emerging. I think there's some really interesting questions that are going to emerge in the future around IPS cells and the degree to which existing patents touch on IPS cells, to what degree they're patentable, and how that kind of those kinds of patents are going to impact the research environment. So I'll end there and say thank you very much for your patience.
I hope what we've shown you over the course of this panel is that as the science has moved, the thinking around some of the ethical and societal legal issues has also been moving in many ways from where it began over these sort of just distinct questions about questions of the embryo and moved much, much further. Because we got a late start and we need to keep the whole conference on schedule, we're going to do the somewhat ethical thing of stopping conversation here so people can take a biological break before the session starts at 4. Please join me in thanking the panelists for their presentations.